We go inside your health now. And do you know that doctors recommend swapping out sugary beverages like pop for water? You probably know that. Bottled water is actually America's most popular drink. According to the latest statistics, Americans drink more than 360 16-ounce bottles every year. But could the plastic containers that the bottled water comes in be undermining some of the health benefits? We have our KSTP health expert, Dr. Arkel Giorgio, here now to take a closer look at all of this. Plastics are everywhere, Arkel. Even if we're worried about it, you can hardly avoid it, right?
We're breathing them, we're drinking them,
Yes.
they're everywhere. They're in the soil. We're not going to get rid of them anytime soon.
No.
But this study that's come up really should make us stop and pause.
Okay, so tell us about it. It's in the New England Journal of Medicine, and it showed some really concerning health effects, right?
It did. This was a well-done study. So here's what they did. They took 312 patients that had never had a stroke, but what they did have was a narrowing in their carotid arteries. Your carotids are the blood vessels that give blood flow to your brain. They went in and did surgery on those people to clear out the plaque in their carotids to prevent a stroke, and then they use an electron microscope to look at the plaque to see who had microplastics and nanoplastics and who did not. And what they showed, over half, 58% of the people had those plastics in the plaque, and in that group, those people had over twice the risk of having a heart attack, a stroke, or death in the next 33 months.
Wow, this is
was
significant.
Remarkable.
Okay, talk more, though, about nanoplastics and microplastics and really what they are for all of us.
So what they are, the difference is about size.
Okay.
And so a microplastic is less than the size of a pencil eraser, and it can get even smaller than that. But then a nanoplastic is even smaller, and it's about 1,000th the size of a human hair. So they're really small. And what's important to know is that the smaller they are, the more dangerous they are, because they can make their way into cells, into organs, into blood flow. So the smaller they are, the worse they are.
And they can cause heart attack and stroke because they're so small. Is that it?
That's right. And we don't exactly know the mechanism, but what we do know is that they can enter cells, they can disrupt cell function, they can begin to block blood flow, and just really cause havoc in the body. Mm-hmm. And so what's also interesting, I was speaking to the Mayo doctor who wasn't involved in this study, but is involved in many other studies around how nanoplastics affect gastrointestinal disease. Mm-hmm. And he was sharing how not only can it be linked to heart disease and stroke, but also liver disease, maybe colon cancer, other autoimmune diseases because it causes inflammation. I mean, so plastics could really be causing some of the odd changes that we've seen in health risks over the last few decades.
So there are a lot of people studying these plastics right now, but so many of us are still using them all the time. What can you do to try to protect yourself?
Right, so we're never going to get rid of them, like at least in our lifetime, because they're plastics that do a lot of good. But we can take individual action, and the action is important for all of us, but especially our children and young individuals. Yeah. Things that you can do that are easy is decrease the amount of bottled water that you're drinking out of a plastic container. There was a study earlier this year that showed that bottled water, 1 liter, has 240,000 particles of plastic in it. That is a lot. When you're in the grocery store, choose a food that's packaged in paper or stainless steel or glass rather than plastic. Don't microwave in plastic. It can cause leaching into your food and you're ingesting it. So there's so many things that you can do to decrease your exposure to plastics, and especially your kids.
Your kids. All right, very important topic. We're so glad you brought it to us. Arkel, thank you. We'll be right back.